Hey, new day, new video. This one looking at sexual behaviors. All right, so this is actually maybe more difficult than we realize. So, for example, just trying to define what sex is actually a lot more complicated than what most people assume. All right, so we want to look at the different types of sexual activity and how those definitions may vary across different time periods, different cultures, um, and all those things. Right. So, um, what we found is that from research, there's actually a lot of disagreement about what behaviors count as sex itself. All right. So, would everyone define kissing, oral sex, sexting, or mutual touching as quote unquote having sex? Right? So some people might say yes to some of those things, but no to other ones. And so it's like, at what point is something considered actual sex? Right? So even outside of that, sexual behavior itself includes a wide range of activities that can be done individually or with another person or people. So they can include things like kissing, touching, masturbation, oral sex, intercourse, fantasy, digital intimacy, emotional intimacy. Right? There's some newer things that we might be seeing. But what we want to kind of pay attention to is that ideas about what is normal or acceptable in a sexual sense are strongly influenced by culture and society. All right. So if you think about where we live here in the United States compared to other parts of the world, we're going to see dramatically different attitudes when it comes to things like nudity and how much of that is permissible. It's pleasure, right? Masturbation, is that something that's acceptable or is it sinful? Sex education, is that something that's done in school, at home? If done in school, what types of things are appropriate to talk about versus not talk about? When it comes to premarital sex, what are the views there? What are the traditional gender roles that are viewed within that particular society or culture? All right, so we're going to see some societies and cultures throughout the world that are pretty restrictive, while other ones tend to be pretty permissive and liberal. And so we want to stand that there is no one universal definition of what it is to have normal sexual behavior. And a lot of the norms that we do have are socially constructed and historically shaped. Right? And so modernly, as we look at the times that we're currently living in, a lot of our ideas about sexuality are influenced by things like social media, pornography, and how readily available it is, dating apps and how they are set up, religion and senses of spirituality, peers and the people that we associate with on a daily basis. And one of the things that we consistently are continuing to see is entertainment media, right? The shows and the TV and the movies that we are watching. So, kind of related to all that, there's a very important idea of what's called sexual scripts. Okay. So these are rules that we have learned about the way we should behave or how we're expected to behave sexually. All right. So this is the way we think things should be. All right. So I'm emphasizing those words to place some doubt in there that we want to maybe question some of these things. All right. But when we look at sexual scripts, they do kind of provide the blueprint and outline of what we expect when it comes to dating behavior and how that should look, how communication within a relationship should look, who we should be attracted to and what we consider to be attractive, what are gender expectations, how those should be expressed, what sexual behaviors are okay, what are the roles that we play within relationships and how those look. A lot of things that go into this. And these sexual scripts have a lot of like sources in how we learn them. Right. So what we're going to see is, like with most things, we learn it from our family. Right. What did our family teach us about things? What have our friends and the relationships we've had there taught us about things? Do we have some type of religion or spirituality in our life, and how has that shaped it? Media continues again to be a huge thing in how it shapes us. The overall culture in which we live in that particular society But even then, just our individual experiences that we've had personally throughout life, how potentially have those shaped our sexual scripts? Okay, so just for comparison, let's look at maybe some traditional sexual scripts, comparing them to contemporary ones, right? So some traditional ones that we may have seen at times are examples. Men should be the one to initiate sex. Women should be passive. Sex always follows a predictable sequence. Orgasm should happen every time. And let's say men are always interested in sex. Okay, so those are some traditional scripts. What we're going to see is that they can be unrealistic and actually be harmful to communication and intimacy in a lot of ways. So by comparison, some contemporary scripts that we see is more about shared responsibility, open communication, mutual pleasure, okay, respecting boundaries, and discussing things like needs honestly. Okay, so we want to kind of move beyond things that are harmful that maybe don't apply anymore, but also just be aware of how we have been influenced in our development of these sexual scripts. Right, so if you think about the rom-coms out there, right, what unrealistic portrayals have we seen about what it means to be romantic or how it is in relationships as we compare that to like real life and what happens in just something like communication, how that works in relationship. So just a critical thinking question for us to consider is that if we go back and look at all those sources of sexual scripts, right, so culture, family, peers, religion, all those different sources, which one do you think has the greatest influence and why, right? And at the same time, which one maybe has the least influence and why, right? So just to help us kind of think about this a little more, okay? Now, when it comes to sexual behaviors, a very important topic with this is consent, right? So consent is at the foundation of all healthy sexual behavior, right? So defining consent is multifaceted. So one key features that we want to make sure are present with consent is one, that is voluntary, right? There's no pressure or coercion involved. Two, that it is informed. You are aware of what the behaviors are, the consequences and risks with those behaviors, anything that may be associated with that, okay? Three, it's mutual, right? You both are consenting to the same thing if multiple people are involved. It's something that's also ongoing, right? So just because someone has consented one time or for one behavior doesn't mean they've consented to that behavior every time, right? Or because they consented to this one sexual behavior doesn't mean they've also consented to this other sexual behavior. Okay, so it's ongoing. And it can be revoked at any time, right? So that all these form the basis of healthy consent that should be present, all right? But silence is not consent. Pressure is not consent. And again, prior consent does not guarantee future consent, okay? So someone can agree to one activity but not another, or they can change their mind at any point, okay? With this, though, what's important is that there are communication differences between people and oftentimes between men and women. All right, so women will often communicate consent verbally, right? They're going to tell you, right? Men may rely more on nonverbal cues, right? So if you have men and women coming together for sexual behavior and they're communicating differently their consent and how they view consent, that miscommunication can lead to problems, right? That's why it's best to be very direct, but we want to consider why might some people avoid those direct conversations about boundaries or consent. Like why is there some like resistance there? Okay. So kind of playing in with consent as well, kind of tied in very closely with it are safer sex practices, right? So these are things that can help reduce the spread of sexually transmitted infections and diseases. It can prevent unintended or unwanted pregnancies and also just reduce anxiety and uncertainty in a relationship. So common methods, you look at physical things like the use of condoms or things like dental dams, but we also want to build knowledge and awareness, right? So how familiar are you with sexually transmitted infections and how that works, right? How open and honest are you with your communication with partners about your own sexual history, contraceptive preferences, your boundaries, your comfort levels? Okay. So the thing with safer sex practices, without going into a lot of detail, if we kind of just want to sum it up, is safer sex lowers risk, but no strategy completely removes it. Okay, so there are going to be pros and cons to everything. And again, that's where that knowledge and awareness comes in. Okay. All right. So major takeaway that we want from this is that when we look at healthy sexuality, that depends less on following the script or what should be happening and more about communication, consent, honesty, respect, and a mutual understanding. Okay. And then questions for us to consider is, as you reflect on your own life, where do you feel that you've learned most sexual expectations, right? Where do your own sexual scripts come from? With that, how do you think media has shaped your expectations about relationships and what you believe they should look like? And then again, why is communication about sexuality so difficult sometimes, right? So just some questions for us to consider.